Hello, this is Jim Cochran talking to Ellen Idler at Emory University about faith communities, vaccines, and public health.
All my life, I've studied religion and health. I did my dissertation on this topic, pretty much like thinking I was the only person in the world who was studying this, which I really was practically. So there's a very consistent finding in the research literature that people who socially, physically participate in religious services have better health than people who don't. It's really very convincing evidence. And as another aside, I'm on a Delphi where you have a panel of experts the people at Harvard who are doing a big systematic review of research on religion and the public health. So there's a preponderance of evidence, right, that this social dimension of participation is really a very good thing for people's health. And Durkheim told us that, at the beginning of the 20th century. So I've been interested in whether, in a more secular context, does the lack of attendance at religious services, is that still a risk for health, or is it still protective? And it doesn't seem to be any different. It's just that there's a whole lot fewer people that are getting the protection because there's a whole lot fewer people participating than there were in the past. There's so much leadership in so many important movements for democracy and for racial justice and for health justice, and there really is inspiring leadership that has such a long, important historical tradition. And if I have to put my hope anywhere, it is that being out in front of many of these movements, and William Barber he and Stacey Abrams, let's just turn the whole thing over to the two of them. They could get us out of this. Their moral suasion is so powerful. If young people are to start to, ever return, it would be because of the powerful social justice voice that still exists and is so much more important than it ever was before. So I've been writing about secularization in this context that I think most people doing any kind of research on religion and health aren't thinking about at all. Referring back to what you said, stuck at the individual level. We did that special issue of the American Journal of Public Health that Gary and TC contributed to, trying to get those people who are interested only in the individual level to think about the power of organizations and social movements. It's not as if there's a disconnect, because individuals' participation in organizations gives them, the additional social capital that people who don't have those links do not have. And the power of organizations to convene people and to mobilize people. Last week, the National Council of Churches, they have a Faiths for Vaccines group. And if you want to look that up, Faiths with a 4 numeral vaccines, they did a 3-hour webinar, and it was awesome, with every major religious group in the U.S. involved in it. It was just all the ways in which organizations can be the trusted messengers and provide the facilities and increase the number of people who are vaccinated because they can speak to them in the best way. That organization's leadership, not only in the social movement world, but also in the public health world, has been really great. Unlike in Western Europe, where there's universal healthcare and a recognition that healthcare is a human right, unlike that, we have a market-driven, capitalistic, profit, gouging healthcare system here that leaves lots of people out. And so public health is so much at odds with the whole rest of the way the healthcare system is run. Even Medicare is now being privatized in a very bad way. 30% more. It's going up all the time. Of people who are on Medicare are being pushed into Medicare Part C, which is run by private insurance companies. Public health is up against everybody, we're just like individualism is run amok, and it's all got to be about making money, and people understand that. And healthcare, that's what healthcare is, and people just accept the appalling situation that we've got. That's why I try to teach 100 undergraduates every semester about the nature of our healthcare system, because they take it for granted. They think that's what everybody's country's like. I've heard so many of them say to me, we had no idea. And I feel like, maybe that's the most important thing I do, is educating them about how screwed up our healthcare system is.